we need to reshape that behavioral association. It's one of the reasons why we see that behavioral responses don't always mimic treatment responses like these studies down there. We need to think about how we retrain the horse. We need to think about reshaping behavior. We need to recognize that pain reduces cognitive capacity. It's hard to learn when you're in pain or when you're anticipating pain. So they will not learn as fast as they did before they had a painful event. This is whether it be lameness, this is whether it be gastric disease, anything that's chronic pain. So we need to treat them like a 5-year-old that's learning for the first time, not an experienced schoolmaster that quote unquote should know better. Traditional training doesn't work better. You cannot scare a horse that's scared into not being scared. And a lot of traditional training is based around pressure or intimidation and release. You cannot scare a horse to not being scared by scaring it. We need to think shifting into positive reinforcement training for these horses is critical to reshape those associations. And recognizing these associations can be very context or environmentally specific. It might be one corner of the arena that they're very reactive to. Traditionally, we used to flood them. We used to keep taking them back there until they got over it. Now we think about, can we reshape the behavior somewhere else, rebuild their confidence, reshape their associations, and then reintroduce them to that stimuli when their threshold is much better and they're improved.